All right. Hi, everybody. We're going to do just a couple repeats because we got off pretty quickly last week. What we're going to do today is to cover the proposed approach section and also the organizational capacity. And then we're also going to discuss some funding opportunities and resources. So I'm going to do the first few slides quickly because we went over these last time, but I just want to kind of remind you where we were. And the goal is to identify and select practices that are culturally relevant and that are actually totally aligned with whatever the needs are in your tribal community. And so we know there's a shortage of programs. We know that are designed by and for Native people. Luckily, there's a lot more now than there used to be, and there's a lot in process. But we also know that those of you who are operating tribal opioid response programs are being asked to provide medication assisted treatment using one of the federally approved medications for opioid treatment, methadone, buprenorphine, or naltrexone. We know that some Native communities are not wildly supportive of Western medication. And so while this is a life-saving medication, is saving lives every day, we know that some tribal communities that are having some hesitation are having great success taking kind of a two-eyed seeing approach of blending the medication, the Western medication, with tribal traditional practices, talking circles, healing circles, sweat lodges, smudging, just different kinds of practices. And we do have some examples of that available at the American Indian Alaska Native ATTC. This is a great publication. I covered this last week that talks about sort of blending traditional and modern Western medicine approaches. This particular document here shows you some evidence-based children's practices by and for Native children. These particular documents here, the one on the left can be found at the Mental Health Technology Training Center at the American Indian Alaska Native TTC, and then the one on the right was developed by JBS, where I work with our Center for Native Child and Family Resilience, and it's a literature review of evidence-based practices that are effective with tribal communities, mostly I think school-aged youth and families. And then these right here, and these are all links that you have access to because you got this PowerPoint in advance. These evidence-based practices are more manuals. You can download them and they're free, and they show you the actual, like a whole manual about how to do a particular evidence-based program. And if you haven't spent any time at SAMHSA's Tribal Affairs website, I would highly recommend it. You can link to some fabulous Native specific data that you can use in your needs assessment, and also link to some special programs, and a few more are here. So this is where we left off last week. And now what we'll do is, I did want to mention, I can't remember if we covered this slide last week, that there is some incredible research going on at Washington State University that is happening with tribal communities that are implementing a very successful treatment model called contingency management, which basically provides some reinforcements, some incentives when individuals show up for treatment. And this is primarily, I think, for methamphetamine addiction, but they are having phenomenal success with this. And they're using culturally relevant incentives and also, I believe, cash. So there's a lot of work finally going on in the effective practices range. I prefer to call them effective practices rather than evidence-based practices, because in Indian country, we know there are literally thousands of years of practices that are effective that may be transmitted orally. And so they don't have this, scientific base that you can look up on somebody's registry, but they're nonetheless effective. And so, and I think most federal agencies are getting more willing to accept native practices that may or may not be in a registry that the feds know about. And Ella, I see that 3 people have entered the waiting room. I don't know if those are people for this class or for the mix-up, but so then is that something I'm supposed to do something about, or you're doing it?
No, I can cover that.
You are. Okay, thank you. Thanks, Ella. Okay, so once you look at your needs assessment data and you go through all these various evidence-based practices that we just discussed, then you decide, okay, what makes the most logical link between the needs, the data that show the need, and the proposed approach of your effective practices. And what happens when I've reviewed grants, I am totally amazed at how many people will say they start with, oh, we've picked contingency management, or we've picked, you know, nurturing families, or whatever the practice is. But they fail to discuss why did you pick that over other options you may have looked at or possibly selected? How will you recruit and retain the individuals to that special effective program that you're saying you're going to implement? Does all of this square with whatever the required activities are that the feds want you to implement? They may say you must also implement workforce development and training. You must also implement strategic planning. You must also implement 5 other things. So this section is usually where you not only talk about the evidence-based practice you propose, but also these other activities that the grant requires. Also, usually when you implement an evidence-based practice, you're supposed to do something called fidelity monitoring. So let's use a simple example. Let's pretend that you are implementing an evidence-based practice that has 6 modules, and they're to be implemented sequentially. And if the supervisor of this program were to pop in unexpectedly on module 3 on the 3rd session, to see whether or not whoever's running this particular practice is implementing it as it was designed. So are they in fact implementing module 3 on the 3rd week? And also, are they implementing it as it was designed? So this idea of sort of unannounced monitoring to make sure that whoever is in charge of implementing your effective practices is doing it in the way that you said you would do it. So that's called with fidelity. And so what happens is how you monitor fidelity is often determined by whether or not the model or program that you picked has a fidelity monitoring checklist. Sometimes it comes with one, and you literally take it and put it on a clipboard, and you go out to wherever the place is that the program or practice is being implemented, and you do an observation. Is this being done? Check. Is this being done? No. You check it off as if it's being implemented in the right way. But if the developer doesn't have one, then you can make one up. That basically, you just look at what you're supposed to do and then do a quick summary and make a little checklist. And so because what will happen if you don't get the promised outcomes, the outcomes that the developer of that practice says you should get, then the very first thing you look at is, are we implementing it as it was intended? And so you go back and you revisit your fidelity monitoring. Some real important catchphrases that I would highly recommend you put in your grant is, not only do you want to tell the reviewer that you are planning to monitor fidelity, but use this phrase, say, wayward correction, or we're going to have correction of wayward implementation. So in other words, if the implementation is off course, if it's not being implemented the way it's supposed to, then what that's called is wayward implementation. So you'll want to be able to uh, say in your grant writing that you have a plan to monitor fidelity and a plan to correct wayward implementation. And Ella, I don't know if you see, we have another person waiting for the waiting room. Now, one of the issues with fidelity monitoring is that how do you do wayward correction? So if you find out, oh, my implementer made a mistake and they should have been on module 3 and they were on module 2, or they were randomly implementing the modules, they didn't understand they were to put them in a particular order, that's an easy correction. But if you have a situation where your implementation fidelity is wayward because your implementing staff are just not doing it the way they're supposed to, you may have to offer some sort of corrective action, or you may have to take some special steps to kind of get them back on board and make sure they understand how to implement, or maybe they need to be retrained. All of these things I just discussed should be in your timeline chart. So your timeline chart would be, select your evidence-based program or your effective program or practice, schedule, implementation, schedule fidelity monitoring, monthly, quarterly, however you think it should be monitored, or maybe the funder might tell you, the developer of the effective model might tell you this should be monitored monthly, quarterly, whatever they tell you, and then have the sentence that says correct wayward implementation. You don't have to give a lot of details of how you do that, but basically you're letting them know we're going to ride an effective pony across the finish line. And if it runs off the track, we're going to get it back on track and keep it, plowing ahead. So that's basically what you're going to do. So this is a chart. I love to use charts. I told you, with having a limited real estate for grant writing, when these grants are down to 10 pages, that's not a lot to work with. And so I try to use charts when I can. And what I love, love, love about this chart, but you make them out to be what they need to be. This is a chart I created where I took the column on the left, which is population of focus, needs and issues. I took, what did my needs data look like? That the kids that we were going to be working with had post-traumatic stress, they had depression, they had anxiety, they had externalizing acting out behaviors, and they had sexualized behaviors. And those were the particular characteristics of this group that I was working with. Then when we went and looked for a matching evidence-based program, the trauma-informed program we came up with, I literally charted, well, what does this evidence-based program offer to line up with these needs? And so this kind of showed all the different things that the program I picked is offering and how it lines up with the needs. And you may not ever find this to be a one-for-one match. And you can see I did some tricky things, like I merged. I'm famous for creating charts where if I can't answer every row, I merge a few together and then put something in there that kind of spans multiple areas. So you can see that in the right, where I merged depression and anxiety, because some of the same components of the evidence-based program addressed each one of those. And so anyway, this chart is what I put next to the sentence that said, justify why you selected this program. Why did you select this over all the other ones you could have selected? So this kind of a chart that you can create, column 1, what did your needs say? Column 2, what are the core components of the program you picked? And you can make this up literally based on whatever it is that you need. So this is just kind of a nifty way to display need against program component. So I'm going to give you some examples. Here's a weak example. We propose to serve Native youth for our 3-year project. We will provide individual, group, and family mental health counseling. The program is offered every 3 months. Counseling sessions will last an hour and will be offered Monday through Friday during regular business hours. That's very generic. That doesn't tell me really a whole lot. So here's one that's a little better. I named the evidence-based program that we're actually going to implement, that it was adapted from another Native model called Project Venture, and that it's a nationally recognized program. It does happen to be on the Federal National Registry of Effective Programs and Practices website, although that doesn't exist anymore, so that's kind of immaterial. Then we go on to talk about how this project's been implemented into Native school communities, and what the different benefits were, and that it's been adapted to work with other needs. and that this, has now been running more than a decade, and that we selected this model because it's one of the only proven effective programs for Native youth with mental health disorders and suicide risk, yada, yada, yada. So, and this was from a grant I wrote several years ago. And then lastly, that it aligns with the needs of our population of focus and their families whose trauma exposure has resulted in depression and anxiety and externalizing behaviors. And we were able to align our desired outcomes in these critical areas to the core components of the model. And I showed you that in the chart a few minutes ago. So it's a close fit. And then I showed you the chart already. Here's another example that would be a stronger example of this is just a partial example, by the way. This would not be the only text you would put, but I just want you to see the level of detail that the feds typically expect in these grant proposals. Our program proposes to serve 250 Native youth. I tell you the age range, I tell you the gender breakout. That's a guess. You only can guess at these unless you have a captive audience. Like if you're working in a jail or a juvenile delinquency facility where it's all male or all female, or what the breakout is. So it may vary month to month, quarter to quarter, but this was just an approximation. We talked about using near peers. That's a term when you're using people in recovery that maybe they're not kids. If you're trying to serve, let's say, 16-year-olds, you don't want to hire staff who are only 16 that are in recovery. You want them to be older and have some recovery under their belt. So we call those near peers. They might be somebody in their early 20s who can relate to a teen. So they're a near peer. But we also talk about why that's important, that they're similar in age for credibility purposes, but yet they've had some stable recovery under their belt. We talk a little bit about how using near peers is what we do to promote effective recruitment and retention. I refer back to our statement of need and what the barriers are and how important it is to have a welcoming environment and so forth. That we're going to have these computer setups where kids can do their homework and they can job search, they can develop resumes and so forth and so on. So if you look at this, this is just showing you why is one weaker and one stronger. The weaker ones are vague. There's no examples of similar projects. The staffing is really not described. The experience isn't clear. Partners aren't described and so forth. And yet the stronger examples, if you went on to read the rest of those sections, that there's more specific examples and experienced staff and partnerships are described, and we have a management plan. So this is so important. Please, please, please identify how you will find your participants. We do not believe the if we build it, they will come. This has to be, what will you do to get out there and get those people to your program that you're proposing? This is the Fed's worst nightmare. I imagine IHS's worst nightmare, that they fund all these projects. The grant writer talks a good game. We're going to have 100 people a month or whatever they say. Then when push comes to shove and the thing gets going, lo and behold, they are just not getting the traction that they needed. So basically, you need to talk about that. If it's a captive audience, like you're going to provide the program or the practice in a school, in a detention center, in a community after school recreation program, someplace where you've got warm bodies that are kind of there for a duration, for a period of time, then you don't have to worry so much about how they're going to get there. But if you are requiring somebody to refer somebody to you to get your proposed program, then you want to talk about, what do those referral pipelines look like? That's a very key phrase you should write down, referral pipeline. When you use a phrase like referral pipeline, that sounds just like what it is, that you've got a massive flow coming to you of referrals. And obviously don't say that if it's not true, but you want to do the best that you can to have a real referral pipeline. So in your timeline, you might say, I'm going to go, meet with all of our referral sources. I'm going to update our referral forms. I'm going to develop memorandums of understanding or agreement, or I might update them if I already have them in place. I'm going to do training and education on the new program that we're asking for funding for. I'm going to, check in with them every month to see how the referrals are going and if they're having any difficulty accessing our program. So think through every single step that it would take to get somebody to your front door Do they need transportation vouchers? Are you going to pick them up? Are you going to do it virtually if you can't get them there? You know, what will you do? What kind of social marketing? If you have not seen our free posters that JBS created, and they're now housed at the American Indian Alaska Native ATTC. They were developed by and for Native people, with room for you to customize and put your own name of your own program in. And we have them for adults and kids, and they're all very kind of clever. And we're doing, I think, 4 or 5 more this week. One of the tribes loved them and said, can we customize them a little bit to our tribe? And so we're going to give that a whirl this week and see if we can do that for them. So basically, we should have some more there on the website soon. But even things like, we will utilize the social marketing posters that were developed by and for Native people from the American Indian Alaska Native ATTC. So by all means, leverage the American Indian Alaska Native ATTC. There's a bunch of information there. We have job descriptions. We have interview guides, how you can interview staff for your program, what kind of questions you would ask. We have so many resources that you can put. We have sample PowerPoints that you can make your own, to educate people in the community, that get them on board with your new program, that kind of a thing. Use words like barrier reduction. What will you do? You know, hopefully you've identified the barriers to the people that live in your community in section A, statement of need. Well, now's your time to talk about, what are you going to do about those? What are your barrier reduction strategies? And if they're having transportation barriers, cost barriers, stigma barriers, if stigma is a barrier, which we know it is in a lot of tribal communities, maybe you talk about, we're going to be implementing a concurrent anti-stigma campaign. We're going to be, and we have PowerPoints on that you can download from the American Indian Alaska Native ATTC. So these are not things that are difficult, that you can get lots of points by mentioning these things in your narrative. Lastly, on this page, how will you include the perception of care or feedback in your ongoing continuous quality improvement strategies? So you really want to make sure that anytime you're implementing any kind of program or service, forget that it's a new something that you might be applying for. Just if you're already doing something, be sure that you offer what's called a perception of care survey. You might rename it something that you like better, but basically you should at least be asking 3 or 4 or 5 questions of every person who comes to your program. You know, what did we offer that you found the most valuable? What do you wish we had offered that you could have helped you and wasn't available? Maybe what other kind of needs would you like to see our company or our program or our tribe develop programming for? These kind of things. And then what will happen is you can not only tell the grant reviewer when you're writing your grant, we will implement our client perception of care surveys. We will review the comments. We will make improvements as needed. And then you might also ask your referral sources. You might do a 3 or 4 quickie little survey for them. Did you find referring clients to our program easy? What would have made it a more successful connection? Do you have a good understanding of what we offer? So always take care of your referral pipelines. Make sure you have something about that in the grant, in your timeline, if no other location, because again, you don't have a lot of room. I want to stop here and see if we have any questions before we go to the last section of the PowerPoint. And Elle, I don't know if you want to call them out or if you see any questions.
This is Megan, Pam.
Hey, Megan.
Questions. Hi. The questions like those identified in other important proposed project details usually be outlined in the NOFO, or will we need to remember to address these without prompt?
And the beginning of that was, I lost you. What is it? The required activities, or what was the question about?
Like the questions that are identified in other important proposed project details will be outlined in the NOFO, or will we need to remember to address these without prompt?
Oh, these right here. You really should address them. Don't assume that the reviewer will know that you have a strategy to get people to your front door. So I think the more thorough you can be, if it's something that you have a good answer for. I never volunteer something if I'm not asked I don't ever volunteer something if I don't have a good answer, or if I don't feel like I can add value to my score. If they ask you and you don't have a good answer, what you can say is be honest. You can say, this particular area represents an area of interest and growth for our tribe. While we are admittedly, learning more about this, we will apply our values of, good quality service to make sure that this is done in an outstanding way. In other words, anytime you can't answer a question directly because you haven't done it before, what's the closest you can get to that? And then describe that, but line it up as best you can. So, if you've never implemented continuing quality improvement before, probably you have, you just didn't know that's what it was called. That would be an example where you would say, the values of our tribe are, holistic, high quality services. We will take that, goal or that value and apply it to the work that we do in this area. So always try to answer if there's a question. If not, it's up to you whether you've got space, but I would at least put it, and I'm famous for also adding this sentence. If I'm out of room and I want to mention something, I will say, and I do this a lot, due to the space constraints of this section, or due to the space constraints of this proposal, a robust response is not possible. However, our abbreviated response is, and then give a smaller abbreviated response. And then you can say, full information is available on file. Okay, I hope that answered the question. Okay, so now we're going to go to preparing. This is kind of the last section that you usually have in a grant. You've identified the needs, you've identified your proposed approach. Now you're going to say the part about, well, how can I convince you as the funder that we've got the capacity to do everything we just said we would do? What is our tribal or organizational capacity? What is our workforce, our management information systems, our infrastructure? What do we have, what it takes to do what we just said?
May I interrupt for one moment? I'm so sorry.
Yeah.
Oh, thank you. This is I'm Linda Santi. I asked the last question.
Oh, yeah.
So before we move on, those struck me, as have other parts of this presentation, as really great questions, which I don't know that I always see in the application guidelines. So my question was more like, do I need to copy this page and pin it to a wall, or
I would. I mean, I brought in $100 million doing this so part-time you wouldn't believe it, and I have a 90-something% success rate, and I do it. That's why I'm telling you what I do, what works for me, and it is rare that I get grants sometimes when they fund 6 or 7 and they get 300 and 400 applications. So that's why I'm only telling you what I know, what works. So I would absolutely pin this and do this, even if you're not asked, with the exception that you don't want to go over your page limits, obviously.
Right.
It's more important that you answer the questions you are asked fully and completely. And so I wouldn't short something that has points to add extra, but I would, even if you can do nothing, Linda, but tease, maybe at the end you say, while identification, engagement, no, I would say while recruitment, engagement, and retention are not requested in this section, we are aware of their importance and have strategies on file to respond accordingly. That at least, even if you get that 1 or 2 sentences in, that lets the reviewer know, wow, that they've gone to this extra step here. And I have confidence now that if I have to bet on this horse or a different horse, I'm going to bet on the one that, has this full understanding. Does that make sense?
It does. Thank you. And thank you both for the overall strategy and then the tactics for how to squeeze it in.
Yeah. Yeah, that's the name of the game, squeezing. Okay, so we're going to move on to the workforce now. So, when you think about the effective practices that you want to implement or the programs, and usually it takes multiple evidence-based practices or programs in order to meet all the needs. And sometimes I tell people they're trying to do too much for too many, like many of our grants where they could have picked a small subpopulation like teenagers or pregnant women or adults or older adults. They'll say everyone. Okay, well, that's fine, and maybe that is a good strategy, especially if you've got a small tribe and you're trying to get your numbers up. But remember that if you're going to serve everyone, you're not going to find a one size fits all program very easily. And so that means you might now have to have two or three different evidence-based practices. And then you got to describe all of them, and you got to describe, how and justify why you picked all them. And then remember, it has a ripple effect into the workforce, because now you've got to have a workforce that can work with teens, that can work with older adults, that can work with pregnant women, da da da. And so there's always this cascading effect, and grant reviewers can see this coming a mile away. They may say, "Oh, how naive! This grant writer thinks they're going to serve the entire universe." Now, in small tribal communities, you may have to, again, just to get enough warm bodies, there to make it worth the federal investment. But if you do have to do that, I'm going to tell you right now, I have two recommendations three that you give careful consideration to. And that is picking a program like either motivational interviewing, which is basically the same no matter what age, or trauma informed care, which is more of like a framework of how you approach things in a very sensitive way. You can do that across the age spectrum, or even contingency management, where you have incentives for people that come when they're supposed to come for their sessions, or that have a negative drug screen. They get a chance to either pick something, or to pick out of a fishbowl a chance to win something. Maybe not everybody does, but they at least have a chance every time to maybe they pick a little, thing that says great job, or maybe they end up one day they pick something that gives them free movie passes or something. I don't know. But those three, the motivational interviewing, the trauma informed care, and the contingency management, and there's others, but those are three broad-based models that pretty much work across the age spectrum. Now, using the one I just picked of the contingency management, the rewards would be different for an adolescent than maybe an older teen, than a young adult, than an adult, than an older adult. So obviously you have to shift a little bit there. But let's now springboard into what are the implications for the workforce. So whatever it is you picked, what are the skills that are needed? And do you have those skills? What kind of training and workforce development do you need to do with your own staff that you're going to hire, or that you already have that you're going to train for this new thing that gets funded? But also, what do you need to do with your partners? And the stigma is huge. There's so many issues dealing with, if you're dealing with stimulant use disorder and opioid use disorder, so many of the partners just think you can just get over it. They don't understand the neuroscience of the brain. They don't understand how your brain has been hijacked by these drugs, that it will be many, many, many months post stabilization, whether you go through a detox and then get on a medication or whatever you do. It will be many, many months before your brain will return to normal. And that will be a slow process, and in some cases may not be completely normal. But you're going to have clients who, some of them will show, like in the famous examples in child welfare, where the parents may have, we call it anhedonia, which is like lack of pleasure, that because their brain is still impaired, even if they're no longer using, it's taking many months for them to experience pleasure again when their dopamine levels get restored. So a child welfare worker who's not educated about this may think this mother or this father is not bonding with their child, doesn't love their child, is not appropriate with their child, when that may be absolutely further from the truth. But yet you're just not giving that parent enough time and water under the bridge, so to speak, for that healing to happen. So I raise this because it is critical to make sure you don't just throw a program up because it gets funded, There's so much work that has to be done to lay the foundation, to lay that groundwork for your tribe to understand the complications of substance use disorder or mental health disorder, for the referring partners to understand. People need to understand no matter what happens, people don't just walk across the golden arches of a drug treatment program and become drug free. The drugs are a symptom of long-standing, deep-rooted problems that don't go away magically because they step across the threshold of your door. That this is going to be many, many months of getting better, getting worse, 2 steps forward, 3 steps back. But over time, you want to see progress in the right direction. And that, yes, of course, they're going to have positive drug screens, minimally for cannabis, probably for other drugs. And that's what we expect. And we have to work with and through it, and it will take time. And if you don't do that groundwork, and if you don't tell the grant reviewer that you understand that that training and education and workforce development and referral pipeline development needs to be done, then you've missed an opportunity to maybe get extra points with your grant reviewer that, wow, this provider's got it going on. This tribe's got it going on. They know what they're doing. So really think through all of that training, including even how to make a referral. You know, some things, my other famous example is that a lot of times the child welfare system will get all mad because they'll say, I sent so-and-so to this new program that they just got funded, and the client got there and didn't get admitted. And we got information back that said the client did not have a drug problem. Okay, well, if you as a child welfare worker sent a client to a treatment assessment and never bothered to send in advance to the assessor what information you had, obviously that has to be done with proper consent. But if you didn't tell them, hey, we did a site visit, we did a home visit, the protective investigator saw evidence of drugs in the home. This is the second time this client's been in the system with their kids. They've got 2 arrests for drugs. If you don't communicate that to the intake worker, then they only have the word of the person sitting in the chair getting interviewed for the assessment as to why they're there. And usually that client will say, I don't know why I'm here. My worker told me I had to check this box. I'm just here to check this off and say I did it. So again, even that level of training to the referral sources to make sure everybody is all lined up to do their part in this new program that you're asking for funding for. So also, again, we have tons and tons of training materials that you can take and adapt for your local use. So under this organizational capacity, these are the things you usually have to answer. What is your history and experience? Let's start with that one first. So, you know, normally we go from the broad to the specific. And you don't want to spend too much time in long ago history. They're really more interested in 2 things. Are you cutting your teeth on this? In other words, is this your first time out of the gate doing something? Or have you had other experience similar that you can call upon that will guide you as you implement this shiny new program that we're going to fund? So how this might look is, you know, the XYZ tribe was established in 1840. You know, it's a federally recognized tribe. We have 1,000 members, whatever it is. We run our own health and human services, or we go to IHS, whatever your setup is, you would describe very briefly. But primarily look at the topic of the grant you're writing, and that's really what you're going to dwell more on. And so then you going from this broad, zooming down to similar projects. If you have implemented similar projects, either in size or scope or topic, then you would want to really zoom in on that pretty quickly. So then you would say, you know, something like, while our tribe has not implemented substance use disorder programming here to date, we have successfully implemented for 20 years mental health programming, of which many of those individuals had co-occurring substance use problems. And we will be applying, you know, our knowledge of that along with the new training and expertise we will develop under this new initiative. You know, so you find ways to kind of segue into what it is that you do well. Let's say you've implemented that you've never implemented on this particular topic, but you have implemented, let's say you've implemented a large federal project on a completely different topic. That's okay. You can say, we have successfully implemented 7 other large scale federal projects or several projects of similar scale and scope to this, though not on this topic. And they want to know, how successful were they? Did you meet your goals? Did you, are you considered in good standing? Did you wrap them up successfully, or were they taken away from you for performance failure? So really the funder wants to know, can I count on this grantee to do a good job? What is in their past experience that makes me feel good? Like, even if they're new at this one thing, that they have something they can call upon that's similar. If you have any certifications or licenses, if you're a licensed mental health provider or substance use provider, if you have so if the program or facility is licensed or has some kind of healthcare licensing or fire health and safety licensing, mention that. If you have clinical staff that are licensed professionally, mention that. So anything, what this does is it shows the grant reviewer that external to your tribe or your organization or school, there are groups that have recognized your value or who have been there to inspect, or that your staff have reached a certain level of competency. So anytime you can, and you may or may not be asked to give copies of these things in the attachments, and you might not have a lot of room to discuss them all, but you can say even something like our 7 certifications, 4 licenses, 19 certified staff, 20, you can summarize all in one sentence, all these different kinds of evidence that show that y'all know what you're doing. If you have any financial audits that show sound financial practices, they don't usually want them attached or anything, but you can certainly mention, we've had 10 years of, and if you've had bad financial audits before that, just don't mention that. Just go with whatever period have been good. You can just say our past, for example, our past 3 years of financial audits have demonstrated sound financial practices and yada, 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 whatever your accountant tells you, you can say. You want to describe your proposed partners and their experience if you've got room and if it's asked. If not, work it in if you have even a couple of sentences, because most funders know that there's very little any of us can do in a vacuum. The clients that we serve in health and human services don't come with one problem. Substance use is not their problem. They have decades or historical traumas. They have, all kinds of health and human service needs. They may have living in violent situations still, or they may have domestic violence in the past. They have all kinds of challenges and needs, and it takes a village. And so mentioning that you have other partners with experience is very helpful. Normally, they want some kind of project management plan. If they don't, this would fall into the same category, Linda, that we just spoke about. If your funder doesn't ask you for a project management plan and you have room, I would say something like, our team will meet once a week for a staff meeting during the first 6 months of startup. We will then assess the need for a weekly staff meeting and may make it bi-weekly or monthly. Once a month, we will meet with our referral sources to make sure that they are, having good experience with our new program. During our staff meetings, we will utilize our timeline. We will use that as one of our agenda items to make sure that we are on track for timely and accurate implementation. We will also review any data that comes in from the program, from the clients, to make sure that we are meeting their needs. If we find out we're not, we will make, immediate corrections. If we do implementation fidelity monitoring and find a need, we will make those corrections. So in other words, it's not like you get the funding and you tell your staff, go, okay, we got the money, we're going. No, there's a whole process of how you will implement that. And there's lots of deadlines and lots of startup and staff that have to be hired and staff that have to be trained and referral sources that have to be trained and MOUs that might have to be updated or put in place, memorandums of understanding, things like that. So there should be some kind of plan, and you may not be able to attach it. They may not want it. They may not ask for it in the grant, but I would at a minimum let them know, that there is one and that you have it on file, or you will have it on file, should they want to take a look at it. Also, most funders want to know, who are your key staff. They don't necessarily want to know about every last person and your part-time receptionist and this, that, and the other, but they do want to know your key staff, your project director, maybe some clinicians. They might want to know about your evaluator, that kind of a thing. And then they want to know. So what will normally happen in SAMHSA? SAMHSA always asks this: who are your proposed key staff, the role of each, their level of effort, and their qualifications. I guarantee you that half of all the responses that we get at SAMHSA gets on that question do not do those things. It's almost like the grant writer reads that sentence and then just gives you a couple of paragraphs about the staff. You really need to answer each, what is their, and I have an example in a minute, but you've got to include everything they ask for and go back. And I even leave the little prompts in, and I don't remove them till I can prove that I've answered every little thing. I can find it in the grant narrative. What is your recruitment process? The last thing a funder wants to know is that you're going to burn up a bunch of the clock by an extensive recruitment process. Maybe the best thing to do is to begin, to have an ongoing recruitment process. Most tribal communities and organizations and schools have an ongoing staff recruitment process. I live in a tiny little rural town, and our town is now offering a $500 sign-on bonus for Taco Bell, for goodness sakes. We cannot keep staff. So most organizations have ongoing recruitment. That would be worthy of mentioning. In our we will monitor our ongoing recruitment process to identify staff that are most directly aligned with the requirements of this grant. We will expedite hiring and da 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 da. Okay, sufficient training of staff. What is your pre-service training and what is your ongoing training that you are going to offer? And Ella, we got somebody in the waiting room. If and how you plan to sustain all or part of your proposed project, that is often asked for in this section, not always. Will you do that by billing Medicaid so that you won't need all the treatment dollars because you're eventually going to pay for it through Medicaid? Will you be looking for other funders? Will you have such good outcomes that other people will step up to help continue your project, sustain it? As an example, one project we did such a good job keeping our clients out of the emergency room because they were always going there with their kids, even for like a fever. They never had primary care arrangements. We made sure every one of our clients learned how to find a primary care doctor that they could afford. We took them there to meet them. We helped them interview. We did everything to get them set up. And then we essentially put no further drain on our ER for these kinds of, visits. And because of that, the ER ended up giving us some funding. So, be creative into how you might be able to sustain all or part of your project and mention your early thoughts about that if they ask you. If not, and you have a good strategy, you might throw it in, even a couple sentences. Again, prefaced by space constraints do not allow for a full articulation of our strategy or a full review. However, we begin planning for sustainability from the moment we get the grant. And you might even make sure you have a line item in your timeline that shows planning for sustainability. All your job descriptions should include cultural competence, should include experience working with Native, and not just experience, successful experience and credibility working with Native populations, da 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 da. And then, getting your resumes. Normally, the resumes for SAMHSA can only be 2 pages. Your job descriptions can only be 1 page. Again, you can get some examples of job descriptions from the American Indian Alaska Native ATTC. I created a couple examples there. I think one for family a family coordinator, and then I did one for a project director. And you may have to tweak it because I did it for tribal opioid response, but you can use a lot of that same language. Just pull it right down. And these are all things you can do long before a grant has even hit the street. These are things you can begin pulling together as time allows so that whenever an opportunity does come, you're ready to rock and roll. So here's a sample staffing chart. So you can see I took every one of those things they asked for. Who are your key personnel? What's your level of effort? What is their role? What are their qualifications? And then there you may have to put TBD, to be determined, or TBH, to be hired. I do highly recommend if there's any way you can at a minimum have your project director identified in advance, even if it's somebody from your tribe or your school that you're going to move into that job if you get the funding, and then replace them in whatever job they left at a later time. That's if they're a good fit, that's usually better than knowing you're going to start a whole project without even having a single person ready to roll when the funding starts. This is what always happens with the feds. They tell people you got to get this program's up usually within 90 to 120 days, so 3 or 4 months, and often it's 6 or 8 months in before they even get the staff on board. This is a real prickly area. So anything you can do. I always say things like, review our diverse ready applicant pool. And that lets people know I got a pool of applicants, they're diverse and they're ready. Like I've already got a group I can look at right away. I don't have to start advertising and then have them come in and then have them give notice. I mean, that may end up happening, but you want to give them as much confidence that you're moving quickly. Developing your partnerships, you can do that now. Again, think about what it is you need, what kind of partners would be ideal to have. If you already haven't developed those partnerships, it's a lot better to do it now before a funding opportunity comes out than when you have a very abbreviated time frame and you're scrambling. And then they think, wow, you ignored me all these years and now there's a chance to get some money and I'm your new best friend, you know? So it's always better to get out there in advance of any funding if you can. And so they also know that sustaining initiatives are much better if you've got partners, especially if what you're doing improves your partners. Like one of the things we know from really good drug treatment programming is 2 things improve after that. Their workforce performance usually improves. People that have been out of the workforce, that have been drinking and drugging, then go back into the workforce and can be very successful employees. And we know that they usually begin to get stable housing, and that they have less criminal justice involvement and less child welfare involvement. So if your partners know that by you having this program makes their numbers, their outcomes head in the right direction, they're going to find ways to keep you in business when your funding goes away, if they can. And then to do this, again, now when there's no funding, set up coffees, set up tours of your program, set up meetings. We did such a good job of this when I was running programs. We would have our clients we would buy the food and they would cook. So they would create little coffee cakes and they would put the coffee on and they would get all excited. We would take them to the Goodwill and we would get really great little outfits and they would dress very professionally and they would be there to greet our partners at the door and shake their hand. And these partners were blown away. The last time they saw these clients, they were OD'd in an ER somewhere being brought back to life, or they were getting all their kids taken away and they look like hell warmed over. So the idea that you can send out a really good message by having, and you have to have the right consents and everything, of course, to do any program tours. But, if you want to develop confidence and develop good partners, then invite them to see what you do and what your facility is like, and, or find other ways to do that. So these are just a brief review of the kinds of partners you might have from a state, tribal, county, or local government agency. Health and Human Services, public health, police, fire, parks and rec, transit authorities, cooperative extension, animal control. By the way, this is terrible, but animal control they're the ones that know pretty much before anyone where the meth problems are, where the stimulant use disorders are, because they see the animals that are neglected and dying, that are left out on chains that nobody remembers, that forgets to feed and doesn't take good care of. And so if you're not working with them, that's a really good one to find, sadly, the families you need to see. Education institutions, administrators, teachers, counselors, school nurses, youth organizations, sports teams, community colleges, libraries, there's just all kinds of places, parent groups, youth groups, domestic violence, book clubs, block clubs, media groups, environmental groups, cultural groups, disability specialty, literacy groups. There's a million people out there. And that could make an important contribution to most grants that would fall in the health and human service areas. And of course, medical, mental health. And what's that group? There's a health education group, AHEC. That's also usually a good partner. So if you really want to get the best out of your partners, then you should put a little bit of money in the budget for them, especially if you're going to have them do some heavy lifting. If you're requiring them to send all your referrals to you and your program only lives or die based on referrals, I would throw them, even if it's 10 grand to help them, dedicate somebody to, managing those referrals. Find out, how many hours is that likely to take to do referrals? How many hours per week? How many per month? What does that look like in a year? Maybe you're funding a fourth of a position because that you're wanting that person to spend a fourth of their time on referrals or on case management or whatever it is you're asking them to do. And so sometimes they can give you physical space. One of the best programs I ever ran, I ran in a church. It was an alternative school for kids that were expelled, and we used free space from churches, from all the classrooms that they would normally have a Sunday school in, sat empty Monday through Friday. They were only busy Wednesday night and Sundays. And so I ran a whole school out of churches, and we eventually had to give them some money for electricity and things like that. But there's lots of ways that you can leverage communities for some services and for fixed capital. Okay, so a weak example of what you might see in organizational capacity and staffing. We're a recognized tribe, organized pursuant to so-and-so. The reservations in New Mexico, it includes this many square miles. The tribe's governing body is so-and-so council. The work is carried out by 4 divisions. Our tribal partner with local community organizations will hire staff to carry out the project. That's kind of like no duh. We're going to hire staff to carry out the project. This is not really necessarily helpful. Our project director will have responsibility for managing project activities. Again, no duh. But now a little better, this is our tribe with this many things, this many miles. Our tribe provides a wide spectrum of evidence-based behavioral health prevention and treatment, and our, include assistance, student assistance, and the only services we offer for adults are detox. We have longstanding partnerships. We have formal MOUs with non-tribal partners, residential. Our proposed project will expand current adult service array to include outpatient MAT. Our proposed program will be carried out by a project director, 2 counselors, a care coordinator, all will be full-time, and a part-time doctor or nurse. The tribal members with suitable qualifications will be prioritized to fill, Telebehavioral health will also be explored when needed, The chart below reflects our plan. So you can see, a lot more detail in the second example. Again, these are all partial, so it's really hard to get a sense, but and here's another example of a chart where you can see what the staff look like if they're to be hired, whether they're full-time or not, what kind of experience you expect them to have. And this particular chart comes right out of a SAMHSA grant writing manual that I'm going to show you the link to in a few minutes. And there's the link to the actual grant writing manual to the left. And it's a very good source for giving you examples on how to write. Some more on stronger examples. The project director will lead weekly staff meetings. It will include the project evaluator. That's huge because often grants will have a project director, then it has someone else doing the evaluation. There's never any communication between the two. And so this is really important that you're saying, we're going to include our project evaluator. It might be by phone, but they're going to be part and parcel from the beginning to end. And that we're going to review our project implementation plan. That's what's going to kind of drive the agenda of our project management. We're going to make sure our deadlines are being met, that things are being implemented with fidelity, that our wayward implementation is promptly corrected. Any mid-project adjustments will be undertaken after continuous quality improvement, and so forth and so on. So you can see how more detailed, there's just more meat on the bones. And that's the difference here between the weaker example and the stronger examples. Really the level of specificity and just a little bit more detail about staff experience, partnerships, and roles, and that you acknowledge you actually have a plan, that you're a project management plan. Also, if you've got room, your staffing section could include the recruitment process. Where are you going to recruit your staff? Do you already have them, like I said, kind of funneling in through an ongoing recruitment process? Or are you going to go to some particular process to get people to you and then maybe let them know what that is? I think this must be a redundant slide. I'm sorry about that. I know I've already talked about your pre-service and ongoing in-service training, even training around like, are you going to have ethics training? Are you going to have overdose reversal training in case somebody comes in under the influence and overdoses? Are you going to have trauma-informed care training? What is it you're going to have? Cultural sensitivity training. And so normally you're going to be required to do a timeline for most grants. SAMHSA requires mostly that you have your project start within 4 months. So that's, a pretty quick time to get it up and running. Sometimes they'll ask you for a strategic plan. It may say that's due in 60 days or whatever. So I want to show you, there's lots of different ways to format the timeline, but I want to show you why I said this caution. So let's say you're being asked to show a timeline for all 3 or 4 or 5 years of a grant. That's really challenging because you only have so much space with 1-inch margins. So as it is, you got to turn your page sideways. You're going to have to go horizontal to even fit all this stuff on there. And even if you go quarter 1, 2, 3, 4, 5, 4, that's year 1, quarter 1, 2, 3, 4 for year 2, and so forth and so on. You could easily run out of room. But we know that a quarter is for 3 months. So if they told you, oh, we need you to do a timeline and you have to show that you're going to meet, let's say you had to do a strategic plan within 60 days or whatever they tell you you have to do within 60 days. By me putting a little X in quarter 1 doesn't let them know that I met that 60 days because the quarter is 90 days. So if you have to ever do something like that, you might have to put a little asterisk and clarify, okay, yes, my X is showing in quarter 1, but I am aware that I actually need that done in the first 8 weeks of quarter 1, in order to meet that deadline. These are just examples of, I always do codes because you never have room to write out project director, clinical coordinator, advisory council, whatever it is you're going to do. So this is just an example of how you can abbreviate. I do like to add milestones. I always feel like I get like bonus points for that, but often you don't even have room. Sometimes you're just told the project activities, the due date, and who's going to do it. But anyway, so there's some sample milestones if you ever wanted to add something like that. So I'm going to stop now and see what kind of questions we might have while I leave up for you a fabulous resource from SAMHSA that is telling you how they like their grants written. And I've covered quite a bit of it today and last week, but take your time to go through this. This is a real jewel. There's also a phenomenal grant writing course that they just put, I participated in it along with 499 other people. I have yet to see the archived version available to click on. I haven't looked in the last couple of days, and I don't know if they're just not going to put it up or if they had some glitch. But if you happen to see it, it was about a 2-hour long. I think there's something on there for 30 minutes. That isn't it. This is a good couple hour long thing you could click on, and you could hear and see the whole grant writing training. But at a minimum, try to see this, try to get this document downloaded and look through it if you have time. And I'm going to wait and see if we have any questions before we move to the funding charts that I sent you.
So far, Pam, there are no questions, but if anybody wants to unmute, feel free to just directly ask her while we're at this pause. Linda, Santi, do you want to say it out loud?
Sure. Again, these are great tips. Do you have an example of a time where something's had to happen in the first 2 months of a 3-month quarter and how you fit that in? It's 6 of one, half dozen, right?
Yeah.
Put it
So,
in left-hand column, you end up using as much space as.
Yeah. No, it's funny you mentioned that because where I've been writing these for all these years and how I learned that they look at that, because I always thought, hey, I got it in the right quarter, like surely, So what where I learned it is when I went to their training a couple months ago, and they said, beware, if you are using a quarterly breakdown and there is something that is required to be done by us in a particular time that would be too vague by putting it in a quarter, be sure to let us know. And that means you either have to go. So what that means, usually all those required things are the startups. So it may mean that you have to do a 12-month column for year one, and then you go to quarterly for year two and year three, or stick with all quarters and then put a separate row that for anything that's due like in 60 days, put a separate row like strategic plan and say this will be done within 60 days in quarter one. So you just have to asterisk it or put a special row, or go ahead and put every single month for year one if you've got a lot of those kind of quirky startup specified times. Now, if you're picking the time and it's not a requirement, you don't have to worry. As long as you get it in the right quarter, it's no big deal. But if you're trying to meet a federal deadline that they told you must be done, just be real clear that whenever you're done with your timeline and you look at it, you can tell that they know that you are going to get it done on that date because you put an asterisk or you put a special row in or something. Now, can you guys see something called sample funding opportunities? I want to make sure
Emily.
Yep.
Okay, good. Okay.
No, sorry, I think you took, I called you when you took calling me back and.
Linda, you might want to put yourself back on mute.
I don't know.
Yeah, okay. So these sample funding opportunities, I'm going to tell you the most pressing first. Okay. If you click on this little first online library, wiley.com thing, all that is a notice that went out around December that said every single state in the country and the Red Lake tribe is getting a doubling of the money that they spend on publicly funded drug treatment as part of what they call the block grant. So a 1.65 billion with a B extra dollars just went out to the states. So even if the states haven't been cooperative with tribes in the past for whatever reason, now they've got double the money and not a lot of time to get it spent. It might be worth revisiting. But go read the little announcement so you know a little bit more about it. Then you can click on this second one, which shows you what the block grant amounts are so that you'll know how much got doubled. So you can just see what that looks like. And then I may have misspoken last week. I thought the state opioid response money, which is again another federal amount of money that goes out to every state in the country and territories. And I don't know, I think the Red Lake tribe also gets SOAR money. But either way, this SOAR money, unlike block grant, which can be spent on anything, substance abuse, prevention, treatment, or recovery on and all ages and all drugs and alcohol, the state opioid response money can only be spent on opioids and stimulants. And so that's a whole extra pot of money that states have gotten for several years. And many states have not done a good job spending that money down. And now they got it again. They got level funding. I thought they got an extra doubling, but they didn't. But essentially some states, because they got more funding and they hadn't spent all their prior funding, they essentially may have gotten a doubling in their particular circumstance where they have plenty to spend. So these are your low hanging fruit. If you've got, different projects that you would like to get funded, it might be worth meeting with your state folks, even if your relationships in the past have not been all that great. And then this last one down here is the mental health block grant. So you can see what they got in mental health block grant, and there might be, and they received additional funding as well. So there's more money than has ever been given before out in the states right now, and they're in a hurry to spend it. Now, right this moment, this grant opportunity right here, as of 5/11, this grant is out there, and it is from the Bureau of Justice Assistance, and it's very similar to the grants. If any of you have gotten tribal opioid response money, this money is very similar. So you might even have grant content you can repurpose. Now, I believe this is a two-part process where they put you out of your misery early. In other words, they let you do a partial submission, and only if they think you're on the right track do they welcome you back for the full effort. But at least it lets you know if you're not on the ballpark of what they're looking for, you don't have to spend as much time in a torturous process that won't be successful. So that's kind of a cool thing. Then grants.gov, if you only have one place to go look to see what kind of funding, this is probably your go-to move right here. And then all the rest of these that you see here are different places you can go to. These are not, this is not a full list. This is just of the most, the ones that tend to fund the most substance abuse. So SAMHSA, of course, the Administration for Children and Families, that funds a lot of like runaway, child welfare, and because there's such an abuse and neglect kind of funding, trauma, and so there's a lot of carryover there with with substance abuse. Let me go back up here. Here we go. Department of Justice. Bureau of Justice Assistance, which is under the Department of Justice. So these are some links here. Believe it or not, the U.S. Department of Agriculture, that even funds telehealth and telemental health. They had money that they could not give away. They had $500,000 grants that they didn't get enough applicants for. So they just, I think, had to give some of their money back to the Treasury. So be sure, if you have the time to kind of spend time on each of these websites till you get a feel. Again, this is the time to do it before there's an open opportunity with just mere moments to respond. The Department of Education, sometimes they'll have funding opportunities for school-based curricula or after-school programs or screening and assessment. Of course, you have the Indian Health Service, and there's a couple funding announcements there. HRSA, Health Resources Services Administration, they are funding a lot right now in drug abuse, mostly opioid and stimulant. They are funding rural communities like crazy. And so we know a lot of tribal communities fit the rural areas, fit the rural parameters. And there's money out, I think, right now, actually, for something called implementation funding. Now, some of these are 80-page long applications. They might be double spaced, but that's still 40 pages, where SAMP says 10 pages. And that's just a no-brainer. I wish all the other federal agencies could make their proposals as succinct as SAMHSA, because it just gets very hard to respond to some of these when they just go on and on and on. And they're very time consuming, and often they're very redundant, and sometimes they're very confusing. And so it just becomes a brutal process for everyone who's involved. So I want to also show you, and I can take questions at any time. Oh, here's a couple, also some private funding sources you might want to look up. You can Google these. Some of these I think you may have to pay a fee for. I have not had as good of luck with the private foundations as I have with the federal groups. I don't know why that is, but that is the way it seems to be for me anyway. Tell me if you now see on my screen something called state opioid response. Megan, can you see that?
Yep.
State opioid? Yeah.
Yep.
Okay,
Mhm.
good. So I'm going to go down here so you can see this is not the block grant. The block grant's much bigger, but this is, well, I shouldn't say much bigger. Who knows? Might not be, but this is just the money that states were having a hard time spending. So I'm going to go slow. So, and this is one of the documents that I sent you all, or Megan did. So you can see how much money and this is only right here, only on um, opioids and stimulants. And then you get a whole similar amount that's been doubled for all other drugs. It can be stimulants, it can be opioids, it can be alcohol, marijuana, whatever. But the one you're seeing on the screen now is just opioids. I mean, it's just the states are flush, absolutely flush with money. And I can assure you, many of them are worried about how they're going to get it all spent. It does not do any of us good to not spend these funds. That tells Congress we didn't really need it. Sending money back to the Treasury is never a good thing if we can put it to good use, and we should, given this extent of the need that we all know we have. And then let me see. I thought I have one other thing to show you. See screen share again. And I thought I had one more. No, I guess that was it. Yeah, that was all I had. So I'll go back here to see what kinds of questions we might have from folks about any of the things I've covered so far, which last week was statement of need, this week was proposed approach, and the organizational capacity. We don't cover evaluation much because that's a real special kind of expertise. We could always do a evaluation module or webinar or something like that separately, but that's usually grantees will hire their own evaluator, their own external evaluator from a university or from a consulting group, or they may have somebody in their tribe that has that expertise. So we normally don't cover that. We don't cover budgets. I do want to mention that while that if you think about weaving a common message from beginning to end, that you want your need section will be a nice way to articulate what all the needs are and who you're going to serve and a little bit about the area that you're going to do the work in. And then your proposed approach should line hand in glove up with whatever needs you've identified. And then your capacity, your staff should have the skills, and your collaborations and your partners should all have the same skills and experience and training that line up with all of those sections. But where people often forget is that then their job descriptions, they'll turn in a job description from their tribe or from their organization or school that is, for lack of a better word, generic. That's not good. You really need to, even if you're legally required, which many groups are, they're legally required to have a particular job description with certain language on it that they're required to give their employees. Do that when you hire them, but for purposes of turning in the grant, turn in a job description that lines up with exactly what the grant is asking for and what the skill sets are that the evidence-based practice would need, and what what you would want that staff to have to be able to have rapport with whatever client population you are planning to serve. So and then you want the budget. So if you're saying, oh, we're going to do all this fabulous workforce development training, we're going to do stigma prevention, we're going to do opioid effects on the brain, we're going to do all these fabulous trainings, we're going to get trained by the developer on a new evidence-based practice. But then when the grant reviewer turns to the budget, none of that is in there, then they think you're lying. Like, well, wait a minute, you said you were going to do all this training, they're not in here. Well, sometimes it's because your training, maybe you're going to do it in-house, maybe you're going to use other funds, maybe it's part of what you do anyway, so it's already paid for somehow, but you forget to tell the grant reviewer that. So they think you're being disingenuous, that you're claiming you're going to do something you're not. So if you don't have that continuity in the budget, then at least put an asterisk that says all the training proposed in this grant is being paid for in kind through our tribe or through other funds that we have available. Or so at least let them know, hey, we know that this training, we said we were going to do it and we are, you just don't see it in the budget for a good reason. And those are the little nuances that I think people forget, is to have that continuity all the way through so that it's like you're telling a big story, a good, accurate story that has a beginning, a middle, and an end. It all makes sense. And when you start fishing around for job descriptions and, any in budgets and things, that you see a consistent story being told there as well. So I want to stop there for our last 10 minutes and see if anybody has any questions about any of the content that we covered, even last week or this week.
Go ahead and unmute yourself, you guys, if you want to ask her a question. That's not a problem.
And there are no dumb questions.
I think while we're waiting for somebody to ask, the only person I don't have an email for at the moment is Jackie Kiss. If you could send that to me, I can share with you the documents I shared with the others this morning, if you don't mind.
And then also, I did want to, unless somebody is going to ask a question, I did want to mention that when the grants come in for review, and I'm just going to tell you how it was when I reviewed, which was many, many years ago. So it may be different now. But a grant reviewer, such as myself, might get 10 different grants or maybe more. And we have to read through them all. Those, and then I might be assigned primary reviewer for 10. Someone else might get my same 10 and they're assigned as secondary reviewer. And another person might get my same 10 and they're assigned as tertiary reviewer. And so when it comes time to review the grants as a group, whether we're all face to face in DC or whether we do it all virtually, they'll say, okay, reviewer number 1, please describe, what section A of the grant, from Albuquerque. And I'll say, okay, the tribe in Albuquerque, New Mexico, Navajo Nation proposes da 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 da. Their needs data were very current. The data that wasn't current, they made a nice note to say that it was the most recently available data. So I know they did the best they could with that. The need is very clear for suicide prevention. They've done this, they've done that. They did a very nice geographic description. I felt like I was right there in the middle of their area dealing with this crisis because they did such a great job in their articulation of this, da 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 da. Okay, then I sit down. Then they say, okay, whoever had secondary reviewer of Albuquerque, please do your review. And they'll ask them not to repeat anything I said. So they might say, ditto, everything Pam said, I thought the same way. And except I disagree with her about the data, some of that data was old. And I myself found much more recent data. So I really think we should ding them a little bit on the years of the data. It was a little too old to be actionable, And then they'll say, the tertiary reviewer, do you have anything to add or detract from the primary and secondary reviewer? And they might say yes or no, and they'll say their piece. And then they say, okay, assign your points. And I got to tell you, and this is my pet peeve with points. And I want you to give real thought to this. So let's say section A is worth 30 points. What's a 27 compared to a 25? Or what's a 27 to a 28? Or what's a 16 to an 18? I mean, come on, we can all, I think, get behind 1 through 5. If you're a 5, you have hit it out of the ballpark. Nothing could be better than what you did. If you're a 4, you did a pretty darn good job. Maybe not perfect, but you're pretty good. If you did a 3, you're mediocre. You did okay, but nothing great. If you're a 2, you're just not cutting it, but you did the best you could. If you're a 1 or 0, whatever, then you just, you didn't really do a good job. But when you start operationalizing that Likert scale of 1 through 5 into like 30, it's really hard to pin down what does that exactly look like. And I hope grant funders will really think about this, when they start putting these out, because it does put a big burden on the reviewers to explain how, and they are getting better. They're now starting to award, like you might get 30 points in a section, but they might say 5 points to question 1 and 10 points to question 2, where they let you break it down a little easier and figure it out. But that's not always the case. So that's why you have to be crystal clear. And that's why you also want to use lots of charts and graphs. You want it because their eyes start glazing over. These poor grant reviewers, by the time I've read my 10th one, I don't even remember what I read anymore. It's all running together. So I remember things that got me a little choked up. I remember things that were just really compelling, where I'm like, oh my gosh, these people just really need this so badly. And they've made a great case for it. And I want to help, or things that are very clever, or if I learned something. Grant reviewers love to learn things. So, if there's something you teach me about your population or about a new program or practice that you found effective or whatever, I get excited about that. So, and I think that's just human nature for everybody else. So, as you think about writing these sections in advance, because again, everything I've taught up until now are things you can begin writing, taking, chip away at it before an actual funding opportunity becomes available. So now you can start practicing writing what we call boilerplate text. Or if you've already written things before, maybe you dig it back out of your cabinet and you start fine tuning it a little and making improvements using some of the strategies we've discussed in module 1 or 2. So I'll stop now, see if anyone has any questions for our remaining couple of minutes. And meanwhile, while you're thinking, can anyone tell me, is this helpful? I like to get a little feedback if I'm on the right track, because we have two more sessions. And so I want to make sure that this is actually helpful to y'all. And if I'm, hitting it at a level that is making sense. And I'm trying to see how to check that. Come to mama, where is?
I was told this is awesome by Tamara.
Okay, good. Thank you, Tam. All right. So feel free, if there's any, and you can interrupt me if you have any questions. I'm just going to let you know, we have 2 more sessions left. What we're going to start doing is literally showing you how to begin writing from an actual funding announcement. So we're going to take one that has already expired just to show you how to do it. And so this will require us to kind of go on the internet and to, I'll have to go on Advance and get all this downloaded. But we'll be literally, showing you some strategies. We're also going to cover some cool templates, how to create some templates and that you can start filling out for your grants.
Pam,
Yeah.
also just to note that someone who is an experienced grant writer who's, taking this training, is not starting from the beginning, said her head is swirling. So we can imagine how.
Oh, yeah. And bless your hearts, because this was a 2.5-day training that we were asked to put in 6 hours. So I feel like I'm leaving a lot of detail on the floor, but it's a lot. And I feel I'm especially pleased if somebody who's done this for a while feels like they learned anything new. That makes me feel good, because, it's hard to also pace a course when we have such interest far and wide and basic to seasoned, so I just hope everybody takes something away that can make a difference when they write the next time.
Yes, and Pam, correct me if I'm wrong, this presentation that you gave today was part of the PowerPoint you sent for
It
session
is
1, right?
the
So you
second
should
half.
all
Yeah,
have it.
the first
Okay.
module covered 2 sessions, correct?
If you don't have
They got
first
the
one,
handouts and
yeah,
the module.
because some people came into this today instead of last time. If you don't have the handout that we're talking about, that's a PowerPoint that has been converted into a PDF, please email me and I'll send it to you.
And do you want to do your GIPRA announcement now, and then we can all leave?
Nope, we do that at the end, since it's over 8
Oh,
hours.
excellent.
So not till the 25th.
Okay, it's
So,
coming.
yeah.
Okay.
Yeah, so with the respected time and no questions left, Linda had said this was very helpful, and she's already said this to her regional administrator at SAMHSA. So that's good news.
Excellent.
I
Yep.
appreciate that, Linda. So yeah, if you guys don't have something and you need it, just email it to me, since there is some folks on today that were not on the first time. So let me know.
All right.
Okay.
Thank you, everybody. Stay safe out there. See you next time.
Thanks, Pam. We'll see you next week, guys.
Okay.